Hello everyone, welcome back to my channel. This is Dr. Nancy and today I'm here with a new video. First of all, I know right now everyone would be in so much of a panic situation because this cancellation of NEET PG and all the exams are going on. So first thought will be going in everyone's mind that is our FMG going to get cancelled or not. See, I am not knowing about that, but one thing I know for sure that if focusing on that whether our exam is going to get cancelled or not, is it going to help you for exam? No, right? The thing which can be done is that you keep in mind that your exam is on 6th of July and you focus according to that and just continue with your preparations, because it is not in our hand. If the thing is not in our hand, there is no point of thinking about that and just wasting your time and getting panic situation, getting so much of negative thoughts and everything. So it's of no use. So let's focus on controllables and study for 6th of July, and I hope that everyone's preparation is going on good because around 10 days are left. So this is the time where you are supposed to be studying your all the high yield topics and summarizing all the subjects according to that, revising all the subjects with the high yield topics. Now is not the time to revise your entire notes. I already said that in my last video. So this is the time you should be, all the subjects should be going in front of your eyes, but with the high yield topics. Now how you are knowing that it is a high yield topics? If you have did your PYQs and PYTs, so you already know that the topics which usually repeat, they are supposed to be the high yield topics, right? So you are supposed to be going through the high yield topics right now again and again, so that those topics are on entire command. The weak topics or anything which is not important, you are supposed to leave that right now. You have already tried your level best before, you have already revised them before, so no need to go through them if it's a weak thing or you don't know anything about that. No need to read anything new right now, only revise the thing which you have already did again and again. This last 10 days try to give a GT, but according to me, don't give it in that mind that you have to cross 150, because agar 150 cross nahi hua, so you will be really depressed. So firstly only commit to yourself that if I am not going to focus on the marks. अगर 150 क्रॉस हो जाता है then तो no need of that saying about anything, but अगर 150 क्रॉस नहीं होता है तो you don't have to self doubt yourself. Maybe वो GT hard होगा और maybe एक दो mistakes हो गए, but just see that what extra अगर ऐसा कुछ हुआ silly mistakes or something, तो तुमने क्या silly mistakes किया है, that just see and go with that, but don't get depressed and start self doubting yourself. That is not a good idea. If you don't have that thing in mind that you are going to get depressed, please don't give the GT. Just go back to your TND papers or go back to your previous GTs and just revise them. That is all. Apart from that, one thing I would like to say about the last day, that this time, as more of them have got centers not in their all in like very far centers also they have got. A long travel is there for everyone. So as it is, as so much hot it is outside, so just plan your travel accordingly. ऐसा नहीं होना चाहिए that last day you are traveling and you are fully exhausted at night and morning को exam है, because exam also will be hot. I mean, you can't expect that the environment is going to be cold, right? So please plan your travel accordingly. And last day, one thing it is, some people they have a habit, they don't study at last day, or they some people study at last day. So जिसको जिस तरह से accordingly अपने according habit है, they can follow that, but last day you should be having some time for studying according to me, because some high yield topics and some important specific points are there which are supposed to be seen last day. Like what I did last day was, I first of all didn't study for entire 12 hours. Obviously I studied for I think 6 to 7 hours max. I studied at last day because I was not able to study more than that. So what I did was, I saw the tumor stagings all of the subjects, like surgery में हो गया, breast thyroid हो गया, या फिर cervical हो गया, endometrial carcinoma हो गया, ovarian cancers, ovarian tumors, then laryngeal cancers, and so these are some things which I saw on last day, all the stagings with treatment plan. Second, I saw the image based questions of all the subjects which are necessary, like derma ho gaya, micro, patho, all the patho slides you should be seeing. Then surgery procedures, instruments, obs gynae, the ultrasound pictures and everything. So these are some pictures which I saw last days. I kept a folder entirely. I said you before also, I made a folder and I kept, so I was having that, and some PDFs were also provided, so I went through that and all. Apart from that, what else? Some scorings and some charts are there, so that through I went, like GCS, APGAR score and everything, and some last time that pneumonia ka charting, then COPD treatment charting. So these are some things which I specifically kept, because these were my some tricky points which I used to get confused. So I saw that on last day. Apart from that, I didn't study anything last day. One day before, till I planned my volatile subjects like PSM, I devised on the second last day before my exam. And micro, I already said I was doing micro from online videos. So I saw that video, LRR video, on one day before exam, 2 days before exam, because last day I didn't studied anything. I only saw the stagings and everything, and I was not able to study anything. Secondly, you should try to sleep last day. I know that is not possible, saying is easy, but try to sleep at least 2 to 3 hours sleep also. If you are getting, just try to sleep, because if you sleep, it will be little bit better. But if you are not able to sleep, it's okay, because on exam day the adrenaline is so much high that you won't feel that. But if you are able to sleep, please try to take 2 to 3 hours sleep. You should not be studying after 10 to 11 o'clock after. Don't try to study till 1 o'clock one day before exam. That is not an ideal idea. And this last time, I'm not going to give you any kind of routine, like how you should be planning, because I made a routine of myself. Like I put it random subjects together, and one day I was doing 3 subjects, and with big subjects I was doing a small subject. So that way I planned, like if I'm doing surgery, so surgery with I did derma. So that way I planned, and big subjects for I gave. If 12 hours you're giving, so big subject for 6 to 8 hours at least देना ही पड़ेगा. And derma के लिए बचे हुए 4 hours, so 2 hours देने के बाद I used to solve questions. So this way I did. But अगर 3 subjects तुम कर सकते हो, and you are having that much of mental capacity, so करने के बाद भी 2 hours derma के लिए sufficient होता है. So 2 hours you can go and do another subject also, like anesthesia कर लिया, or that way. And with small subjects like ENT किया तो ENT, biochem and anesthesia, that way. So ऐसा 3 subjects and 2 subjects का planning I did. So that was like, it was quick also, and in less time, because high yield topics पढ़ना है, so you are going to already cut on some more time. So उस तरह से 3 subjects was doable. And right now 12 hours तो करना ही करना है. Apart from that, if any kind of negative thoughts are coming, thinking about this exam and everything, cancellation, and how your exam is going to be, July paper hard होता है, and this and that. So my suggestion, don't focus on that. जो भी होता है, that the out of 300, 200s are going to be doable. तुम्हें सिर्फ 150 लाना है, तुम अभी भी 50 और रॉन्ग कर सकते हो. सो इट्स ओके, जस्ट फोकस दैट तुमने अगर पढ़ाई की है एंड यू डिड अ हार्ड वर्क, सो दैट इज गोइंग टू पे यू ऑफ. Just focus on the controllables. Don't focus which is not in your hand. That is not going to give you any kind of good outcome. And just take a deep breath. Say yourself every day before sleeping and getting up from the bed, say that you are going to pass. I can and I will. And just be positive. That is the only thing I would like to say. And that is all from my side. I'll see you in my next video. Till then, revise properly. Just 10 days are left. Go for it. Give your 110%, and I'll see you on the other side. So bye bye, take care, and all the best for the exam.